Good day, and thank you for joining us for another edition of Conversations with AARP in the Virgin Islands. I'm Troy Deshabere-Schuster, State Director for AARP in this territory. In less than a month, millions of Americans are expected to lose their health care coverage under the Medicaid program. This is due largely in part to the end of the public health emergency crisis enacted during the COVID-19 pandemic. According to national statistics, this loss of coverage will impact more than 15 million Americans, including nearly 8,700 persons living here in the Virgin Islands. AARP estimates that many of these people may inappropriately lose their coverage due to inability to navigate the administrative hurdles of this process. Since the passage of the Families First Coronavirus Response Act of 2020 under the public health emergency crisis, the Virgin Islands Department of Human Services has enrolled nearly 10,000 Virgin Islanders in the program. However, with the enactment of the Consolidated Appropriations Act in late 2022, the additional funds to support the new enrollees will be fully eliminated. By March 31st, 2023, that is next month, coverage is scheduled to expire. Recognizing the urgency to mitigate healthcare coverage loss for thousands of Virgin Islanders, AARP has invited the Human Services Commissioner Kimberley Causey-Gomez and Medicaid Director Gary A. Smith to today's show to discuss the series of requirements and actions to best serve the healthcare of Virgin Islanders during this phased down process. And so, welcome, Commissioner Causey-Gomez and Director Smith.
Thank you so much for having us. We really, really appreciate it.
Yes, thank you for having us, Mr. Schuster.
Yeah, it's a pleasure to have you. And unfortunately, it's not a very happy topic. But, I'm sure that you all have plans to help so many Virgin Islanders work through this process and find alternatives. So, starting off first, these new enrollees, does that have anything to do with the expansion of Medicaid due to the Affordable Care Act, or was this solely due to the pandemic that we had an increase, or both? Can you help us to understand these nuances?
I think it was a little bit of both. And I mean, I'll get Director Smith to kind of get on the details. But I think over the last 5 years, we've increased it. Was it like 20%, Director Smith, of our number of Medicaid members? So our membership right now is about 37,500, which is a lot more than we started with before the pandemic. But it's for a couple of reasons. And Director Smith, what do you think that the reasons are we're seeing the increase, especially not nationwide, but also in the Virgin Islands?
So thank you, Commissioner. Thank you for the question, Mr. Schuster. So the increase in Medicaid beneficiaries, is due to subsequent to the two Cat 5 storms in 2017. And with the closing of businesses, persons losing their health insurance coverage through their jobs, and then you get the pandemic, additional job closings. Therefore, that was the major contributor to the increase in our Medicaid beneficiaries.
Okay, so then we see that we have two ways in which it increased. So we're not going to lose all of the people who came on as a result of the Affordable Care Act, right? We're going to lose those who came on as a result of the pandemic. Is my understanding correct?
I wouldn't say necessarily lose because they still may be eligible for Medicaid. So the eligibility requirements are still the same. It's just that because we had automatic extensions for the past 5 years, and we were able to provide continuous coverage. But now we're going back to okay, let's look at really what your circumstances are. so we can ensure that the right people are eligible for the Medicaid program according to the federal guidelines, because we've had a lot of waivers and flexibilities that allow for coverage. And so now we have to take a look at it, not just nationwide, but here locally to look at it. But we want to make sure that we are assuring people that let's look at your circumstances and make sure that you have some coverage. And so we do have some plans that we're exploring for that.
Okay, so Director Smith, if you will, then tell us what are the requirements or what causes somebody to become eligible for Medicaid in general?
Okay, so eligibility, there are two main requirements, which is one, you have to be a U.S. citizen, and second, there's an income requirement. For example, a single person qualifies and cannot be making no more than $15,654 annually. And if you add one additional household or a spouse to that, that increases to $21,000. So then you have to provide a proof of residency. Have to provide some other documentation. Let's say if you're a green card holder, you have to confirm that you've been living in the territory a minimum of 5 years.
Okay. And so can somebody just visit the office and figure all of this out with an agent? How would they go about doing that?
So we have that information on our website, which is www.dhs.vi.gov. And you go to the Medicaid section on the left hand, the menu, and the application, and also what documents are required to apply and become eligible are available there. We also have applications and the same document, explaining to you what documents are required at the front of each of our buildings. You can complete the applications along with attach the documents. We have drop boxes. We are not seeing members or beneficiaries or new applicants in our offices per se, but the front end of our offices are available, and you can be attended to by our eligibility information folks.
So for somebody who may not be savvy at using the internet, surfing the web, they can still come in and speak with the representative.
Yes, sir, they can. And
Okay.
and also, if I may add, sorry, the applications can also be emailed to us. We have email inboxes, sttjmap@dhs.vi.gov. That's for the St. Thomas St. John district, and for St. Croix, we have stxmap@dhs.vi.gov.
What happens if somebody is not eligible for Medicare, not eligible for Medicaid? They have no coverage whatsoever. How can they get some kind of coverage? Does the government have any program to help those who are completely uninsured?
Well, if they're not working, so it depends on the circumstances, really. So if they're not working, most likely, and they don't have an income, most likely they would be eligible for Medicaid. Age requirement, of course, is for Medicare as well. But I think there's some other options, Director Smith.
So we are working on formulating a public option to buy into Medicaid, which is going to, require the collaboration between our governor's office, our legislators, and also, the other public health facilities, the FQHCs, the hospitals. That is something that, it's just in the research phase right now. We don't have much information to share about that, but that is something we'll be working on. We're also taking a look at increasing our income threshold, which would capture some of the persons that will be falling off of our Medicaid rolls. So those are two options that we're taking a look at. We also have to keep in mind, though, that, because we're a territory, our Medicaid program is not treated like the states where their funding is open-ended and our funding is capped.
This is interesting that people could potentially be able to buy into Medicaid in the future. Has that been done in any other state in the Federation, or is it something new to the Medicaid here in the Virgin Islands?
So through our research, we have found that it is there is a type of an option in Nebraska, and I do believe in Pennsylvania. However, though the states have accessibility to the federal marketplace, and some states have their own marketplace when the Affordable Care Act was passed. So the territories were at a disadvantage where we were not eligible to participate in the federal marketplace. So thereby us taking a look at this public option to create an alternative for our uninsured citizens here in the Virgin Islands.
We've heard many times about the cliff in relation to the Affordable Care Act and the expansion of Medicaid here in the territory. That at some point we're going to reach this cliff, and then some of those are going to end up dropping out of Medicaid. Is that a second cliff that we're still looking forward to? So we have one coming up, in a manner of speaking, next month. And is there another potential loss of Medicare recipients later on, another year or 2 years from now? What are we looking forward to?
Well, we finally have a permanent solution, which I think is really awesome, in that it was a collaborative approach between our Medicaid program, our delegate to Congress, Governor Albert Bryan, and his whole entire team regarding the FMAP. And so that's the federal match requirement for us. During the pandemic, we were able to have a lower rate. And so it was always like, oh my gosh, we're going to go back to the 55-45. And 55-45, what does that mean? It's 55% is the federal match, and then the 45 would be for the local match, right? I got that right. I did flip it, right? And so when we say that, that's a lot of money that would come out of the territory for that match. But luckily and blessings, because I think that it was a lot of hard work behind the scenes to ensure that the Virgin Islands had equitable, permanent solution. And I can let Director Smith go into it a little bit more detail, but that equitable, permanent solution is really important. We still have a cap, and that's something that we still need to fight. But Director Smith?
Yeah, so thank you for that segue, Commissioner. That was awesome. We through the omnibus package that was just passed I believe in November, the Virgin Islands and the 3 Pacific Island territories now have a permanent FMAP of 83%. So the local government will require to pay 17%. Also, prior to that, by the way, sorry, Puerto Rico's match is 76%. But prior to that, we received approval and authorization that our funding will no longer dip below what we're currently receiving right now, which this fiscal year we received $135.6 million. Next fiscal year, depending on inflation, we will receive an increase between 2.75 to 4.45%, okay, based on the MCPIU, right, which is a consumer price index. So the VI, the 3 Pacific Island territories will receive that. Puerto Rico has now been placed in a separate bucket where their funding, their FMAP is going to be determined based on law and how Congress rules. However, I think for the next 5 years, they'll be at 76%, and then Congress will have to decide what their FMAP is going to be at that point in time.
Excellent. So I'm glad to know that that issue with regard to the Medicaid expansion related to the Affordable Care Act, that's been dealt with
Yes.
definitively, right? And so
Yeah,
that's
it's
not
good
going to
news
affect
for the
all of
Virgin
those
Islands.
people. Excellent
Very, very
news.
good news for the Virgin Islands. Yes.
Yeah, no, it's amazing news, and I mean, I don't think that the government has ever been able to successfully tackle this issue, and to know that we have this permanent expansion of Medicaid, and it's a real savings to the government. Therefore, the government can use funds that they would normally use for the match to improve the infrastructure of the territory in other ways. It's really, really, really incredible. Can you give us an idea of the exact numbers? So, like, let's say, what was the Medicaid match before the Affordable Care Act, and what is the Medicaid match now? Can you give me a ballpark dollar amount?
Dollar amount, Gary, do you have the dollar amount? I know that for the past 2022, I have numbers for 2022. We spent over $121 million for services. And what does that really mean exactly? You look at the providers, you look about healthcare, right? And, are we able to provide healthcare services in the Virgin Islands for our members? And a lot of times we don't have the healthcare services or the expertise here locally. And so we have probably over 1,200 providers under our Medicaid program. And that's like 30% of those were on island, and the rest of them were off island for services. So a lot of people have to leave their families and their jobs in order to get their health care, their services off island in order to come back. But as far as dollar figures, what does that look like for us in the future? I think it's more positive than negative. And we could have easily dropped back to that 55-45, and that would have been detrimental to the Virgin Islands because we would not have been able to afford that. And a lot of people would have lost coverage because of that.
Hmm. Hmm. Excellent, excellent. So now looking at what's about to happen next month, right? Of the approximately 8,700 people who could lose Medicaid coverage, do you have any idea of how many of those could still qualify and continue with Medicaid coverage, or is that yet to be seen?
Well, our teams are going to be working a lot of hours in order to update the context. And this is where we're asking the community for help. And this is Director Smith and his Medicaid whole team, our communications team, to get something out saying that updating your contact information is going to be crucial to this. There's a way that we can communicate with you, and it could be through text messages, which we have that in our program. That's no cost to you. We can make sure that if we have the correct mailing address, you're going to get that information via mail. We'll have it on our social media and our website, but updating your contact information is going to be crucial when we're coming to recertifications. And I think Director Smith can get into like exactly what that recertification period looks like. We need to expand, obviously, some of our staffing and making sure that we're able to answer the phones and answer questions during this really period of time of uncertainty. And we want to make sure that we're here for you to let you know that we're not going to just let it go by the wayside. We're fighting everything that we can to make sure that you have health coverage and continuous. But Director Smith, please fill in what I missed.
Well, you did an awesome job, Commissioner. You didn't miss much. Most importantly, updating the contact information. There's a lot of return mail when we send notices out. The population we serve are, they're very transient. Addresses change, phone numbers change. So most importantly, updating their contact information. Again, you can go to our website. There's an update my contact link on our website, on the DHS website, and you can update your contact information. That information goes directly to our eligibility and enrollment system. We're also going to be sending out text messages notifying members to, update their contact information. There are two different sites that we have the link on. The DHS website, which I provided that website before, www.dhs.vi.gov, and then also on our Medicaid Management Information System portal, www.vimmis.com. So updating your contact information is most important. We will begin sending out recertification notices on April the 1st for persons whose benefits expire on May 31st. Okay, so we're going to be providing 60-day notification for persons whose benefits will expire on May 31st.
Okay, so these benefits expire May 31st or March 31st?
May 31st. March 31st is the date that programs have to begin the recertification process. We have the flexibility to begin in March. We have to begin by April. So we have determined that we will begin on April the 1st. Their CMS has, even though that March 31st ends, Congress, that's Congress's determination. CMS's ending of the public health emergency is, I think, April 11th. Okay, so we have up until that time to determine when we will begin providing or start the recertification or redetermination process or re-enrollment, which all three mean the same: redetermination, recertification, or re-enrollment or renewals. All of that means the same. But again, listening audience, the AARP team, most importantly, we encourage you to update your contact information so we can make sure that we are, number one, you're going to be receiving your recertification notification. Number two, any additional information that we have to share. And then also, most importantly, work with those persons who, when we perform the redetermination recertification process, we find that they will not be eligible, right? That we can work with them and guide them as to how they may be able to still and continue access care, and working with our FQHCs, the Department of Health clinics, and also the hospitals.
Okay, so just to probe a little deeper now, let's say May 2nd
Yes.
is here, and an individual has not gone through a recertification process yet. They still have coverage until the end of May. Is that absolutely correct?
Yes. So our no one's benefits will expire mid-month.
Okay.
It will always expire at the ending of a month.
Uh-huh.
Okay.
Okay.
So what we will continue to do is provide automatic extension, continuous benefits for those persons whose benefits expired May 31st. So come June 1, persons after that will have to begin the recertification process. Thereby, we start sending our notifications out on April the 1st.
Okay.
So I had a quick
Commissioner?
question, and that might kind of add to it as well, is that the action, it's your health insurance. It's really crucial that you take action, because it's proactive approach to your healthcare. So if I can't help you unless you help yourself in this instance, that if I don't have your updated information for us to be able to give you guidance, then that's the biggest issue for us. So we want to make sure that we don't have return mail, and so that if you go online or have somebody help you go online, to make sure that you're updating that contact information, because that action is going to be required. This is not one of those times when you need to sit back and say, okay, guess what? We're going to get another extension and it's going to be fine. This is not that case. This is the case that you have to take action in order for us to help you. So I want to make sure we're doing that. But Gary, what about over 65-year-olds? Are they eligible for something else that might be helpful?
So our we have received a state plan amendment approval where we will be able to assist our age blind and disabled population, which I know, Mr. Schuster, this is, a special population for you, and that's who your organization began to serve, but it's now expanded to younger persons. But at any rate, we're able to pay for Medicaid eligible Medicare beneficiaries. We're able to pay for their Part B premiums. So when we began this exercise, we had approximately 300 persons that we were paying Part B premiums for. And now we currently have, I think, over 2,000 persons who have Medicare enrolled in Medicaid, but we were not able to pay for their Part B premiums. We will be able to pay for their Part B premiums now.
Well, this is excellent news. Yeah, and very proactive. Excellent,
Yes.
excellent news. And so when somebody comes in to start the recertification process, how long does that take? Can they get recertified for Medicaid in a couple of hours? Does it take days or weeks? What can a person expect as far as time is concerned?
On average, and thank you for that question, because we've been tracking the number of days on average it takes to complete an application, and the average number of days is 5. The highest number I've seen is 6. However, it depends on the member and the submission of all of the requested and required documents. And then also the team being able to get in touch with them to be able to share that information with them, or that we have an updated email address to be able to email them. This is why it's so important for us to have your updated contact information. We have not performed recertifications in the past 5 years. So this is going to be a daunting task for the program, as well as our eligibility and enrollment caseworkers. We see ourselves putting in additional overtime hours. We're hoping to staff up. When we staff up, that staff has to be trained. So this is going to be a monumental task, and I'm sure you've been hearing it from other programs across the nation, because that's all that's on everybody's mind. Medicaid,
Yes.
the public health emergency unwind.
Great. Now we have just about 1 minute left. If you could tell us just very briefly, again, how can people find all of this information to go through this recertification process?
That's good, Director Smith.
Okay. So you can go on the DHS website, www.dhs.vi.gov, and you go to the left menu, click Medicaid, you go to forms, and there's an application. There's also a document that tells you exactly what documents you have to provide. You can also click on the link to update your contact information, and just keep on the lookout. If you're a current Medicaid member, we have a updated or active cell phone number for you. We will be using that platform to provide messages. We are going to be utilizing radio shows such as yours, Mr. Schuster, and hope you invite us back. And then we'll also be using press releases and other media, i.e. commercials and newspapers.
Well, Commissioner Causey-Gomez and Director Smith, thank you so much for being on the show with us today and bringing us this important information. We will invite you again in the very near future. Have a great day.
Thanks.
Thank you.